This is a Baggy Sisa podcast.
We don't want young women to end up in town having illegal abortions done. That's the last thing we want, because you could lose your life, or you could end up losing your uterus and ending up infertile.
Welcome to this edition of the Me and My podcast series for young women. My name is Setumbuli from the Dr Sindi Center for Health Journalism. I've got medical Dr Sindi van Zyl today in studio, and we're talking about unwanted pregnancies. Thank you for joining us, Dr. Sindi. Now, a pregnancy can be a life-altering moment, especially if it's either unplanned or unwanted. If a young woman finds herself in this position, what would you say is the most important thing for them to do?
The most important thing for her to decide is if she wants to keep the baby or not. And then once she's made that decision, she must then take the necessary steps. So if she's decided to keep the baby, you need to go and book at an antenatal clinic. And the reason why booking is so important is because we need to make sure that an HIV test is done and that you're screened for sexually transmitted infections. If you're HIV positive, we'll start you on treatment to make sure that your baby is born HIV-free. If you've made the decision not to keep the baby, then what you want to do is present yourself at a clinic where they offer termination of pregnancy. Whether it's a private sector clinic or a public sector clinic, you need to go there as soon as possible, because there are cutoffs, and we know that after 12 weeks, you won't get a termination of pregnancy done.
In the case where I do not want to stay with my partner, or the pregnancy is a result of a one-night stand, for example, should I be including my partner in these conversations?
Well, it depends on your relationship with the person. I mean, if it's a one-night stand, it makes it a bit more difficult because you don't really know this person. So that's up to you whether you're going to tell them or not. But if you were in a relationship with that person and you feel that telling them is important to you, then you can tell them. But it's all about you and what you think is important for you. It would be unfortunate for you to make decisions based on how you think the other person is going to respond. No, it should always be about you and what you can deal with the coming of this baby.
What are the sort of things that I need to consider whether or not I want to tell this person before I approach the topic with them?
Well, the first thing is your physical safety. So if you're in a relationship with someone who's shown tendencies towards violence, then you'd think twice about telling them. And that really is what I think is the most important thing, your physical safety. I know that in the Black community, cultural issues can come up, especially because the other family might want to know that they have a child. Once you've decided to keep the baby, chat to your elders about it and decide if you're going to send elders to go and report that there is a baby to the other person's family. But don't have any expectations of the other person, because that is almost always a disappointment. You're doing everything for yourself, you're doing everything for your baby. And of course, if it's cultural, you're just doing everything to make sure that you do the right cultural things.
So, Dr. Sindi, for someone considering an abortion, I mean, a lot of us know about Marie Stopes, but what other options? Can you go to a government clinic, for example, to get an abortion?
So yes, you can. So government clinics do offer termination of pregnancy. And if a specific facility doesn't offer it, they have an obligation, an ethical obligation, to refer you to a center that does offer termination of pregnancy. If you want to go to a private doctor, you can. There are private doctors that do offer this service, but I'd prefer people to go to a gynecologist because they're well trained in this field. And if that specific gynecologist can't help you, whether it's for religious reasons and so on, they are also obliged to refer you to a doctor that can help you. So no one can turn you away without giving you an option of where else you can go. It's important to know this. We don't want young women to end up in town having illegal abortions done. That's the last thing we want, because you could lose your life, or you could end up losing your uterus and ending up infertile.
So talk to me a bit about the costing of these different options.
So in the government facilities, it's free of charge. At Marie Stopes, it's about 2,500 rand. In some places, it's 1,500 rand. I think it depends on what sedation they offer you. And then obviously with a private doctor, you'd pay your consultation fee, and then whatever else they'll charge, maybe for the sonar and the procedure itself. And with gynaes charge about 2,000 rand for consultation, and the gynae will then tell you how much the procedure itself is going to cost.
Could you perhaps walk us through the procedure as well? A lot of young women might be a bit scared because they don't know what to expect.
Well, first of all, you need to be counseled about what's going to happen. They look at how far along you are with your pregnancy, and you'll either have a medical abortion done where you're given a tablet and then the fetus is expelled from your body, or you'll have a surgical procedure done where they'll have to take you to theatre and, expel the fetus from your body surgically. But you need to know, how far along you are and which of the two options you're going to go for. So in the early stages of pregnancy, from 0 to about 9 weeks, you have the medical or the surgical option available to you. But from 9 weeks upwards, the surgical option is what's offered to you.
And what are the risks involved with these options?
Well, if you have a termination of pregnancy done at a place that is registered and there are people that are qualified to perform the procedure, then there are no risks. Our concern is if you go to a center or to a person that is not qualified, that's where you're most likely to encounter side effects or end up with an infection or end up bleeding, and that's what we don't want.
That's it for today. Thank you so much for joining us, Dr. Sindi. The sound production for this podcast was done by Danny Boysen. The executive producer for the series is Mia Malan, and I'm Setu Mbuli. Thank you for joining us.
This was a Peggy Sisa podcast.